Good morning. My name is Steve Islava. I'm the president of Care 2 Innovations, and I've been a fireman paramedic for over 30 years, and I've been inventing medical products for over 20 years. My new product, the Stabilize in Place Cervical Collar, was designed because there's so many studies that are saying do not put traction on the neck, and the rigid collars cause traction on the neck. Dr. Raymond Fowler, one of the founders of Gathering with the Eagles, has said we need to move away from the rigid collars and do not put any traction on the neck. It causes damage to the ligaments and the spinal cord and can do more harm. So when you're evaluating my new Stabilize in Place collar and you apply it on, it fits to any patient, from the little lady with osteoporosis to someone with kyphosis or a big football player or a small child. Now I put it on, I vacuum the air out, and I'm stabilized in place. And more importantly, I am really comfortable. I could lay or sit with my neck stabilized for a long time in this comfort. Now, you applying this, and you're a paramedic or EMT or doctor or whatever, you might say, oh, there's some movement, a little bit more movement. Well, because you're stabilized in place and you're not an injured patient. The patient is injured. They fell down some stairs and have a hematoma, or they got rear-ended by another car going 40 miles an hour. The human body splints itself. And if you splint yourself, and then all of a sudden the paramedics come and they put this collar on you and they're stretching your neck so you can fit into their collar, is what you need to move away from. Do not put traction on the neck. And some people say, oh, it's more stable. That's because it's putting traction on the neck, not more stable. It's causing you not to move. But 5-6 minutes into it, it's digging into your neck, it's causing pain, and the patient's moving all over trying to get the collar off. We've all been there in the back of the ambulance as we've seen that. So keep the patient comfortable and stabilize them in place is what the medical directors are stating. This is why the Stabilize in Place collar is absolutely perfect for everybody. We need to move away from thinking we need to put traction on the neck to make them stable. That does not make them stable, okay? Now, the other issue that someone might have is, oh, I need access to the neck. Okay, well, you did your medical assessment, you evaluate, and then you put a collar on the patient. And then when would you need access to the neck? A tension pneumothorax, where you need to see JVD or deviated trachea? Well, that is a 0.001% call in your lifetime. Actually, I've only had one in my 30-year career. But we need to see, some people want access to the neck. Well, can you see JVD in this? Really, every paramedic or medical doctor is going to, if they really want to see JVD, they're going to open up and see it. JVD is way out here. It's really hard for you to visualize JVD in an emergency when you are getting ready to stick a needle in someone's chest. You can quickly pop a collar off, any collar, and then put a collar back on. So when else would you need to access the neck? Well, let's say, oh, I want a carotid pulse. Okay, well, a carotid pulse means that you're probably doing CPR and the patient is not going to move, and you can open it, reach for a carotid pulse, and then put it back right on because it's still molded to the patient's neck. It's like their custom collar. Reach for a carotid, take a look, put it back on. It's that simple. And that is a rare call, because 99.9% of the patients you want need to be stabilized in place and comfortable. You don't need access for 0.001% of the patients, when in reality, you would still open up that collar to look for JVD. And another issue that someone has is, oh, I want to have for a needle crike. Well, a needle crike is a very rare call as well. Very rare. People don't get that in their careers. Okay? I've never had it in my career. I've always been able to do something else. But airway first. So you need to get a needle crike, get your needle crike, go for it, do whatever you can to save that patient. If you still want to put a collar on a patient, you can quickly put it on backwards, and I am stable. I am comfortable like that. I have access here for the resuscitator bag, and you can transport the patient in a very stable position. I feel stable. I didn't even vacuum the air out, but it is comfortable and stable. Nobody's going to do a needle crike through a collar. Nobody in their right mind. That is such a difficult procedure in the first place, let alone having to find it, slide it, angle it. We know. And it's really hard to get someone to breathe through a 10 gauge needle. Orange County Fire doesn't do needle crikes anymore. LA County's not in their protocol anymore as well. But if you have it, put it on backwards. You'll be perfect with this collar. Thank you very much for your time. I love you all. Take care.